Hello, so good morning, everybody. My name is Antonio D'Angelo, and I'm here to present you Medicud. Medicud was born from a discussion I had with a surgeon in which we identified a significant unmet clinical need. The result is Dryum, the most advanced incisional negative pressure wound therapy device designed to prevent infections and, more generally, complications. It is both affordable and sustainable. There is a severe unmet need in surgical incision. Millions of women are delivering their babies through cesarean section and face the risk of developing the infamous surgical site infection. Today, there are no satisfactory solutions, so there is not any prophylactic treatment. It's not only about cesarean section. Surgical site infection is the reality for 10% of every surgical patient. With more than 230 million incisional surgeries performed every year, it makes a staggering 23 million infections per year. This translates in a 10 billion euro annual cost spent just in Europe and US to treat those infections, and 12 days extra hospital stay. Current solutions, unfortunately, can combine the low cost, like the standard of care, the absorbent wound dressing, or gold standard performance as actual incisional negative pressure wound therapy device. They are not cost effective, to say the least, and need of improvement to become the new standard of care. Incisional negative pressure mechanism of action combines the removal of exudate and the increased blood flow to the wound site. Medicud has developed Dryum, the novel incisional negative pressure wound therapy device, combining efficacy and cost effectiveness with the aim of making this prophylactic treatment the new standard of care, reducing surgical site infection incidence from 10% to just 3%. Dryum is the only device completely made in the EU. Finally, Dryum can succeed where current incisional negative pressure have failed, replacing the standard of care. With Dryum, we have completely redesigned incisional negative pressure wound therapy. Thanks to the use of an innovative 3D spacer spreading homogeneous pressure, exudate is sucked out through the flexible and flat fluidic connector into the mechanical suction device canister, where it is safely gelled and stored. A total of 5 patents have been filed, 4 on the suction device and 1 on the fluidic connector. Dryum is the most cost-effective solutions, combining cost efficacy due to constant negative pressure and complete exudate removal from the wound. The absence of electronic and the biopolymer production compatibility makes it the most sustainable. Finally, being completely silent and discreet makes it the most user-friendly, maximizing therapy adherence. Dryum is a compelling device with a cost comparable to the standard of care. Incisional wound care is an attractive market because the competitor is winning against standard of care. Medicud wants to start with the 4 most common incisional procedures in the EU and the US: cesarean section, total hip and total knee arthroplasty, and mastectomy, accounting for more than 4.6 million procedures annually in order to disseminate the market and unlock the majority of all the surgical procedures worldwide, a total addressable market valued more than 16 billion euros. Medicud is a team of engineers and scientists working toward the development of the device, while Filippo Forte, our experienced regulatory affairs specialist, is managing all the activities related to the certification of this Class 2A medical device. And Mario Militello, our sales and commercial director with extended experience in market entry, is executing the go-to-market plan. Dryum is a single-use consumable sold via a business-to-business model. As incisional negative pressure wound therapy competitors are sold directly to hospitals, the team identified that the quickest way to take the market is taking advantage of existing agent networks and medical device distributors to widespread Dryum sales, an attractive device to complete their product offering. Concurrent devices seeded the market and worked toward the extended acceptance of the therapy, even with costly and imperfect devices, and paved the road for our affordable and efficient device, Dryum. 1 million in sales is expected in 2026 and profitability in 2028. In 2030, we expect 30 million in sales. To conclude, Dryum is the most advanced incisional negative pressure wound therapy device Medicud is seeking a 2.5 million euro seed round to bring Triumph to the market. Next step are the human pivotal clinical trial, the CE mark as a Class 2A, and subsequent market validation. Thank you.
So my question is, have you treated patients so far in a pilot study, and what were the results of this pilot?
Yes, we have started last week a first-in-human trial where we are treating prophylactic treatment of surgical incision in total hip and total knee arthroplasty. It just started last week.
Thank you.